Back pain can be a real pain in the, well, you know where. But the fact is, it doesn't have to be a constant burden on your life. There's a multitude of things that you can do. Now, one of the biggest things we advocate here at Aspire Physiotherapy is exercise. Follow the blog article below. I'm going to give you 6 key exercises that we like to implement early days when someone has back pain. Follow along. If you have any questions or concerns, reach out to us at Aspire Physiotherapy. Try them out. Experiencing lower back pain and stiffness can significantly impact your daily routine. It can create a lot of physical stress, but also mental stress as well. Now, a lot of people search throughout the plethora of knowledge, throughout a plethora of advice, trying to find out what exactly works. Well, we've created a quick guide to lower back pain that can go through some of the common issues, common concerns. Take a look below. I think you'll find some great information in there. In the first section here, we're going to start by identifying the cause of your lower back pain. So there's 5 main causes. Let's go through them. First cause can be a muscle or a ligament strain. Now this is more from repetitive heavy lifting. Sometimes you'll have an awkward movement. You've done something to strain your back. The next one, which you've probably heard about, is a bulging, a ruptured disc, slip disc. It goes under many names, but it's the same thing. The cushion in between your vertebrae, from flexion, bending forward, over a little bit too much over time, can start pushing back and can start pressing against the nerve. A lot of times you'll start having that sciatic, burning, numbness, tingling type pain down your leg. A lot of times that could be from a bulging disc. The third cause is arthritis. Now, some people may feel this, some people may not, depending on how severe the arthritis is. What basically happens is over time, due to wear and tear, the spinal canals start to narrow just a little bit, and that's where the nerve comes out of. It can create a little bit of pressure, and again, create pain down your leg or through your back. Number 4, we have skeletal irregularities. Now, this is gonna be more of your scoliosis. We have a little bit of that curvature in your back. One side gets a little bit tighter, one side gets a little bit looser. Usually there's a few simple tests that physiotherapists can perform to see if you do have scoliosis or not. Some people have it quite severe, which may need surgery. Some people just need to keep up with a daily exercise routine to kind of manage everything. And finally, we have facet syndrome. Now, this is something which I personally suffer from myself, where you have a little bit of that curvature in your back, and the facet joints can over time start rubbing against each other, causing a little bit of irritation, causing a little bit of swelling potentially, and that can create pain around the back and sometimes even down to the glute region as well. Now, there's a significant amount of treatment options available for back pain. You can go to physio, you can go to massage, you can go to chiropractor, and even your doctor may prescribe some medications for your specific back pain. But there's some things you can do at home before even going through and seeing a specialist, right? So number 1, it's going to be being active. So going to the gym, going for walks. Number 2 is going to be stretching, keeping mobile, keeping your joints moving, because a lot of people don't realize, but your body will stiffen up over time. If you don't stretch, it can create pain in certain parts of the body. Number 3 is maintaining a healthy diet. So just be cautious of what you're eating, how your diet can affect you. It's always a good thing to eat proper, eat healthy. Obviously, we all have a cheat meal here and there, but if majority of your diet is not the greatest, then might be something to look into. Lastly, proper posture. So if you're sitting in an awkward position for a prolonged period of times, that can increase stress in a certain part of the body. Or, we do have people that come in that are plumbers, welders, and they're in awkward positions all the time. And that can contribute to your back pain as well. All right, now we're gonna go through a few myths. Okay, so I've seen this first myth a lot of times, and I do not know why people recommend this. Now, some cases maybe, but generally it's the worst thing you can do. Okay, so first myth, rest is the best cure for back pain. This is absolutely false. I have no idea why people recommend this. Rest is one of the worst things you can do. So we need to start with a little gentle movement, a little bit of activity. And what that's gonna do is it's gonna decrease the stiffness in your back. It's also gonna create circulation and help some of those joints lubricate themselves so you can create pain-free movement. Now, simple movements, simple range of motion is the best thing you can do to start off with most back pain. Myth number 2, severe pain means severe damage. Now, this is false. Small strains, things like that, they can create a high level of pain, but doesn't mean that the injury is significant as well. The smallest things sometimes react and create tightness and stiffness and just can increase your pain levels. Obviously, pain is depending on person to person. I can't feel what you're feeling. You can't feel what I'm feeling. So pain is a very subjective feeling. So just remember, the high level of pains, it doesn't mean you have significant damage. It varies from person to person. Myth number 3, scans will always identify the cause of your back pain. Now, scans are great, they're fantastic. They're a great invention to kind of get to certain things or kind of see inside what's happening, but they're not always going to really identify what's kind of going on with the back, right? Because you could get a scan with the back, an x-ray, an MRI. It might not necessarily show everything, and it's not going to necessarily show if you need to strengthen your back or your core, if there's something going down or something going on with your legs. They're a great tool to use, but they're not necessarily always going to show exactly what's going on with your back. And finally, our last myth: only physical factors will cause back pain, or physical injury, physical harm. Now, this is false. We've had a few patients come in where stress, mental well-being, anxiety, it can stiffen things up and create pain within the body. So it's not always physical factors which is going to create your back pain. Sometimes, the mood that you're in, if you're stressed about something or you have a deadline coming up, that can create back pain or pain in other parts of the body. Now, back pain can't be ignored, as it can significantly impact your physical well-being and mental well-being. Use this guide as a tool to treat or maybe prevent some of your back aches or injuries that you're having. But if you're looking for more of a personalized plan of care, consider seeing one of our experienced professionals at Aspire Physiotherapy, from our physiotherapists, chiropractors, to our massage therapists. They can take a look at you, assess you, and develop a personalized plan of care, which can get you from where you are at the moment to where you want to be. Other than that, all the best, and check out some of our more blog articles, and we can kind of go from there.